Bismillah ar-Rahman ar-Rahim. Today's topic for our discussion is carbon monoxide poisoning. Carbon monoxide poisoning. It's also called as CO poisoning. So it's very much clear from the image which is provided by the CDC of US Department that we cannot see the carbon monoxide, so cannot be seen. There is no specific smell, cannot be smelled, cannot be heard. There is no noise like a leakage of some gases, the LPG gas or leakage of gas in the air conditioner. No. So this is not possible. But one thing is possible with the carbon monoxide is we can prevent the CO poisoning by installing carbon monoxide detector. Installing CO detector can stop the carbon monoxide poisoning. Introduction. Carbon monoxide is a leading cause of poisoning morbidity and mortality in the United States. Each year, more than 1,000 Americans die from unintentional CO poisoning not linked to the fires. More than 20,000 visit the emergency room of the hospital and more than 3,000 are hospitalized. So you can see these statistics indicate uh, the CO poisoning, especially in the US. So around 1,000 people are dying because of CO poisoning, which is unintentional, and it was not linked to the fire. Means it's not because of fire. It may be a natural fire in the forest. No, it was not linked to the fire. It may be some other reason, using for example generator of generator. When there is no electricity in the area, they use the diesel or petrol generator. So it was unintentional and CO poisoning not related to the fire. Okay. CO poisoning causes the acute symptoms such as headache, nausea, weakness, angina, dyspnea, loss of consciousness, and coma. So this you can say these are the symptoms of CO poisoning, starting from small exposure to the large exposure. If someone is exposed to CO small, he may have small headache, nausea. As the exposure increases, there will be breathing problem, dyspnea, angina because the heart is not getting enough oxygen, and sometimes there can be a loss of consciousness and the coma. And the neuropsychiatric symptoms, neuropsychiatric symptoms means the symptoms related to the brain, because when there is a CO exposure, CO poisoning, so of course the oxygen level will go down in the body, and the brain also need oxygen. When the oxygen supply to the brain is less, there will be neuropsychiatric symptoms or the problems in the brain. But these symptoms will not be acute or quickly. These symptoms may develop weeks later. Maybe someone was exposed to CO poisoning today. After 1 or 2 weeks, he will start having the neuropsychiatric symptoms, amnesia, or any other problem. We'll see that. Coming to the diagnosis of CO poisoning, diagnosis is by measuring the level of carboxyhemoglobin. So we will check the level of carboxyhemoglobin and ABG, arterial blood gases, including the oxygen saturation. Okay. Between 2010 and 2014, this around between these 5 years gap, half of all carbon monoxide poisoning emergency department visit, and more than 1/3 of all carbon monoxide poisoning hospitalization were unintentional and not non-fire related CO poisoning. So they have done, the research about the CO poisoning. Of course, all were CO poisoning, but they found that about half of the CO poisoning in this between 2010 and 14, half of them were unintentional and not related to fire. So that you can say UNFR. UNFR means unintentional non-fire related CO poisoning is the leading cause of after natural disaster unintentional poisoning death. Yeah. So you can say UNFR, which is unintentional non-fire related CO poisoning, is the leading cause of after natural disaster unintentional poisoning death. For natural disaster, after natural disaster, for example, uh, if there is a heavy rain, which is a natural disaster, so what will happen? The electricity will go in some places. Am I right? If there is a heavy rain or if there is a thunderstorm, thunderstorm, during the rain, the air which is blowing with a very, very high speed.
Yes, doctor.
Yeah. So thunderstorm, heavy rain, or any other natural disaster, when this happens, the electricity will go, of course. So people either they use generators, or inside their home they may use kerosene, kerosene lamps or something. So their houses will be closed. So unintentional, and it's non-fire related. So there can be a carbon monoxide, and it's actually in US, because natural disasters are more there. So it is a leading poisoning death cause there, UNFR. And approximately 73% of unintentional non-fire related CO exposure occurs at the home. Okay, introduction. How, if suppose someone has got CO poisoning, so the first treatment will be, we have to supplement oxygen, give the oxygen to the patient. That you can say like an antidote. Antidote for CO poisoning is oxygen. Prevention is possible. Yes, most of the time we can prevent the carbon monoxide poisoning. How? By installing household CO detectors. This will be there in every big mall. It is also there in our Al Marifa University, the smoke detectors, which mainly detect smoke, and some specific detector can detect only the carbon monoxide. CO poisoning, one of the most common fatal poisoning, it can also cause death. It occurs by inhalation because it's a gas. CO is a colorless gas, odorless, that result from incomplete combustion of hydrocarbons. Yes. So when the hydrocarbons like diesel, kerosene, petrol, benzene, or any other hydrocarbon, when hydrocarbons are burned or combusted incompletely, when they are burned completely, there will be CO2. When hydrocarbons are burned completely, there will be CO2. When these hydrocarbons are burned incompletely, there will be CO2 plus there will be CO as well. The common sources of CO poisoning include house fire, using fire in the home, improperly vented automobile. Yes, the vehicles, the cars, whose exhaust, there is an exhaust system in the back of car. If this exhaust system is having some problem, so that the gas, or that what you call that exhaust can come inside the vehicle, leaking, and may cause CO poisoning, the one who is driving the car. Gas heaters, furnaces, hot water heaters, wood or charcoal burning stoves, and kerosene heaters. So all these are the common sources of CO poisoning, mainly in the home. Carbon monoxide is produced when the natural gas like methane or propane burns. You know, these are the natural gases, methane, propane. So when these natural gases are burned, then also there will be CO release. Smoking tobacco. Smoking tobacco also causes a CO in the blood, but it is not considered as a poisoning. Why? Because the CO which comes in the blood because of smoking tobacco is not enough to cause poisoning. But there is one important thing you have to memorize. I will tell in the coming slide that when someone come to the hospital with CO poisoning, and you have one patient who is a normal, normal means he don't smoke or drink anything. You have another person, he also has a CO poisoning, but he is a regular smoker. So here you have to be careful, because the hemoglobin level will be different, because one is already a smoker, one is a non-smoker. That is the reason. CO toxicity is especially common during power outages due to storm, as a result of improper use of gasoline powered portable generators to provide electricity, and indoor use of charcoal bricks for cooking and heating. This already I explained. So CO poisoning is very common if there is the current, the electricity goes, mainly because of natural disaster, storm, heavy rain, or any other reason. So in this situation, the people use gasoline powered generator, okay, improper use. Then also inside the home they use the charcoal, the wood for cooking and heating. So that can be the reason. Carbon monoxide is also called as silent killer. Why? What is the reason for this? Can anybody? Why it is called as the silent killer?
Maybe doctor
Maybe
will reduce.
Yes, please. The girl student you started before.
Reem, doctor. Reduce the oxygen level in the body.
Reduce oxygen, not exactly. Yes, any other?
No, because it has no smell and
Yeah,
cannot be detected easily.
yes, because there is no smell, there is no taste, no hearing, no noise. So because of these reasons, it is called a silent, means it's very difficult to detect it unless you have a detector. Okay, that's why silent. CO intoxication also occurs by inhalation of methylene chloride vapors. Okay, if someone inhales the vapor of methylene chloride, he is not inhaling CO. Actually, if the person inhale methylene chloride vapors, which is a volatile liquid, and this methylene chloride will go in his lungs. From the lungs it will go to the blood, from the blood it will go to the liver. In the liver, this methylene chloride is converted to CO. You got the point? As such, methylene chloride is not CO, but if someone inhale the vapors of methylene chloride, then it will go to the lungs, then go to blood, then go to the liver. Liver metabolize methylene chloride into CO. Okay, and where this methylene chloride is present, it is a volatile liquid found in the degreaser. You know the degreasers, This degreaser could be used in the vehicles, the car, and also nowadays some degreasers are available for kitchen, you know, because the kitchen stove which we use, the gas stove, and the place where cooking takes place, it become greasy after few days. So some degreasers are available which are very strong, so that may also have methylene chloride, some solvents, and the paint remover, you know, like a thinner or paint remover chemicals, they also have methylene chloride vapor. So methylene chloride vapors are readily absorbed through the skin or through inhalation, or if someone drink them also ingestion, and it is metabolized in the liver to CO. Yes, so what is the pathophysiology? What exactly happens if someone smoke CO? What is the problem? CO toxicity causes, the main problem is impaired oxygen delivery and utilization at the cellular level. Yes, CO toxicity impairs, yani disturb the exchange of gas, mainly the oxygen. Okay, so it impairs the delivery of oxygen to the cells and also utilization of oxygens to the cells. CO affect several different sites of the body. It can affect any part of the body or any organ, but mainly it affects the brain and the heart. These are the most commonly affected organs of the body. Uh, the elimination half-life of CO is about 4.5 hours with the inhalation of room air. So, you know, what do you mean by half-life? You know already what is half-life. Half-life means it is a time taken
to the drug reach 50% in the body.
yeah, it's time taken by the drug to become to 50%. And if it was 100 milligram, maybe after 1 hour, if it becomes 50 milligrams, so elimination is 1 hour. So here elimination half-life of CO means, suppose someone inhale, just say example, if someone inhale 100 carbon monoxide, just to give an example. So he inhale 100 carbon monoxide, but after some time what happens, this carbon monoxide will eliminate from his body, means it will go out. When it will go out, if he go and take a fresh air in the oxygen, or if he go to the hospital and take the oxygen from oxygen cylinder, or if he go and take any other oxygen treatment, so what happens, carbon monoxide starts going out, that is elimination. So elimination half-life means the CO will become 50% in the body, that is elimination half-life of CO is how much time, 4.5 hours. If someone inhale the room air, any fresh room air, you got the point or no? Is that clear? Yani suppose if someone has inhaled carbon monoxide and in his body there is 100 carbon monoxide, so if he go and take a breath in fresh air and in the room air, so after 4.5 hours carbon monoxide in his body will become 50. Is that clear? Hope this is clear.
Yes, Doctor, it's clear.
Yeah. And the elimination half-life or carbon monoxide is 1.5 hour with 100% oxygen. Yeah, look, any time is decreased. And if someone take a mask, you know, with the oxygen cylinder, if someone take the mask with the oxygen cylinder in the hospital, and if he's inhaling the oxygen which is 100%, so within 1.5 hour the carbon monoxide will become 50%, and he will be removed from his body 50%. Okay, so can anybody tell me how much oxygen is there in the air which we are breathing? We are breathing in our house, in outside the house. How much oxygen is there in the air?
30%, I think.
30%, not true.
maybe 70 or 60%.
No, no, that's too much. Muhammad Haddad, he answered in the chat 21%. Very low amount, you know. The oxygen in the air. Then which is the highest gas in the air? When oxygen is just 21, then which air is there more in the Hawa? I mean,
Maybe nitrogen.
Yeah.
CO2.
Doctor?
which gas is more in the air?
Carbon dioxide, doctor.
Yes,
Nitrogen.
nitrogen. I think, yeah. So means, you know, nitrogen, yes, 78% nitrogen, 21% oxygen, and carbon dioxide and other very small, yeah. Anyway, good. So yeah, let's come back. If someone inhale or take the 100% oxygen, just he need 1.5 hours to remove 50% of carbon monoxide. And you will be shocked to see a person just need 20 minutes to remove the carbon monoxide from his body, 50%, with 3 atmosphere pressure of oxygen using hyperbaric oxygen chamber. Yeah, this is a machine which comes with the oxygen, of course 100% oxygen, but with the high pressure, you know, high atmospheric pressure. You got my point? This machine, just I'll show you photo and I'll go back, because yeah, this machine, this is the hyperbaric oxygen chamber. This machine gives 100% oxygen with high atmospheric pressure. So just requiring 20 minutes to remove 50% of CO from the body. Okay. Next is mechanism of CO toxicity are not completely understood, but the mechanism may involve following. So this is the mechanism by which CO causes damage or toxicity in the body. So what is the first thing? CO displaces oxygen from hemoglobin, because CO has greater affinity. CO has greater affinity, that is 200 times more for hemoglobin than oxygen, and causing formation of carboxyhemoglobin. This is the first problem. So normally what happens in our blood? Oxygen is bound to hemoglobin. You know, this is how the oxygen travel. Am I right? This is how the oxygen travel in the blood. Oxygen binds with the hemoglobin,
Yeah.
and it is moving. So if there is inhalation of carbon monoxide, oxygen will be displaced, removed, and carbon monoxide will come and bind to hemoglobin. This is because of high affinity. And you know, once the CO binds with the hemoglobin, that will become carboxyhemoglobin, which is very important for us in the diagnosis, because we are going to check this in the blood. And it will shift the oxyhemoglobin O2 HB dissociation curve to the left, decreasing the release of O2 from hemoglobin to the tissues. For example, you can see, suppose this is oxygen hemoglobin dissociation curve. Okay, this is oxygen hemoglobin dissociation curve. If there is carbon monoxide poisoning, this curve will become left side, yani it will come like this. So what will happen if the curve oxyhemoglobin dissociation curve, if moves to the left side, what will happen? The problem is there will be decrease release, yani no release of oxygen from hemoglobin. So what will happen? Tissues will not get oxygen. You understood? Yani the oxygen is bind to the hemoglobin. Why? Only like, you know, sayara for to travel in the blood. Once the oxygen and hemoglobin go to the tissue, oxygen should come out from hemoglobin and should be utilized by the tissues. This can only happen if there is dissociation. So when the curve moves to the left, this dissociation decreases, means no release of oxygen from hemoglobin to the tissues. Any tissues will not get enough oxygen. Second toxicity. The third toxicity is inhibition of mitochondrial respiration. You know, this is what is mitochondrial respiration? It is called as, you know, respiratory chain in the mitochondria. Glycolysis, Krebs cycle, ATP synthesis, this procedure which takes place in the mitochondria to synthesize
Yes.
ATP. Yeah, this mechanism need oxygen or no?
Yes, for oxidative phosphorylation.
Yeah, oxidative phosphorylation. So when there is carbon monoxide poisoning, this oxidative phosphorylation will be stopped. So that is another problem. And the third is,
Acidosis.
yes, acidosis. And possibly the carbon monoxide has a direct toxic effect on the brain tissues. Directly it can cause the damage to the brain. Talking about the sign and symptoms of CO poisoning, the symptoms are like a flu, you know, like flu symptom, headache, little nausea, like this. Okay, the same like flu. So actually this is a problem because the symptoms are not specific. Symptoms are like a flu. So if you go to a doctor, or anyone, he go to a doctor and he say, oh, I'm having headache, I feel nausea, I cannot concentrate, what he will think? Does any doctor tell him, oh, you have CO poisoning? No, I think, am I right? He will just think, you maybe you have flu, like this. Am I right? So
Yes.
misdiagnosis can happen. I mean to say, the misdiagnosis, or you can say the CO diagnosis will be uh, hindered. Any doctor will not think. So that's why if it's a duty of a doctor, if a patient is going to the doctor, especially from which place, the places where they mainly use generator, okay, kerosene generators inside the home, cooking with you know, wood and charcoal. Yani you are staying in such a place where there is a lot of use of such hydrocarbons which can make CO, then you should tell the doctor, I am in from this place. So maybe he will suspect. You got my point? The doctor can differentiate and suspect, oh, maybe because you stay in such place, you have a high risk of getting CO poisoning. Okay. Now, symptoms tend to correlate well with the patient's peak blood carboxyhemoglobin level. Yes. This is, I also explained you before, the symptoms, sign and symptoms of CO poisoning dependent on what? They are dependent on how much carboxyhemoglobin is present in the blood. If someone inhales too much CO, symptoms will be different. If someone inhales small amount, it will be different. So the symptoms correlate with the blood carboxyhemoglobin level. And many symptoms are non-specific, as I mentioned, headache, nausea, these non-specific. So let's see how the symptoms correlate with the CO concentration in the blood. A victim can have headache and nausea can begin when the level of carboxyhemoglobin in the blood is 10 to 20%. In a small amount, if 10 to 20%, headache, nausea. If the level of carboxyhemoglobin is more than 20%, the victim can have vague dizziness. You know, dizziness, you know, vague means unclear. He don't know why it is happening. Unclear dizziness. Generalized weakness. This can happen if more than 20%. Difficulty in concentrating and impaired judgment. Can you see all of this related to the brain? Means here actually the brain is not dead or no damage has happened, but here you can see the brain is getting less oxygen. Am I right? That's why the brain is not working properly, cannot concentrate, feeling weak, impaired judgment, vague dizziness, this. And if the level is more than 30%, it can cause dyspnea during exertion. And if you walk somewhere or you run, you go to park, or if you do any physical exertion, you feel difficulty in breathing. Okay. Chest pain, which is an indication that the no enough oxygen to the heart, and confusion. Your internet connection is unstable. Can you hear me?
Yes, doctor.
Doctor, yes.
Thank you. Because sometimes it will show me a message that your internet connection is unstable. High level of carboxyhemoglobin can cause syncope, seizures, and obtundation. Seizure, syncope means like, person is paralyzed and he is able to see, open eyes, but he is not able to move, or he's same like paralyzed. Actually not paralyzed, but you can say like he is paralyzed. He is not moving any body part or not doing any activities. Obtundation, like, sleep. Hypotension, coma, respiratory failure, and even a death. It can occur when the levels are more than 60. So these are the signs and symptoms which correlate with the level of carboxyhemoglobin in the blood. Okay. Now the symptoms are not only related to this. A patient may also have many other symptoms, including visual deficit, having eye problems, cannot see properly, abdominal pain, focal neurological deficit, cannot concentrate. If poisoning is severe, if poisoning was severe, yani suppose he inhale a huge amount of CO, means what will happen? Do you think his brain will get enough oxygen?
No.
No, because the poisoning was severe. But suddenly, but you will not see neurological symptoms ala tul. Yani it will take some days to weeks. After that, he will have neuropsychiatric problem because his brain did not receive enough oxygen. So there was some death in the brain, some cells is not working. So if the poisoning is severe, neuropsychiatric symptoms, signs and symptoms can develop after some days, not the same day or same time, after days to weeks after exposure. Okay, and this damage in the brain can be permanent. What damage in the brain can be permanent? Like a person will have dementia, loss of memory, can have psychosis, Parkinsonism like syndrome, chorea, and amnestic syndrome. Amnesia and dementia same, related to the loss of memory. Psychosis, like schizophrenia. Parkinson's, the tremor and involuntary body movements, Parkinsonism. And chorea is not Korea country. This is chorea means involuntary body movement, which looks like a person is dancing. A person move his body in such a way that you think he is dancing. Actually, he's not dancing. This is a neuropsychiatric problem. Okay. This can happen if this poisoning was severe, because CO poisoning often results from house fire. So sometimes if there is a fire in the house, it can cause CO poisoning. Patient may have concomitant airway injuries, which may increase the risk of respiratory failure. Did you get the point here? Yani, if the poisoning is non-fire related, please remember this. If the poisoning is non-fire related, there will be CO poisoning, of course. If the poisoning is fire related, there will be CO poisoning. Jama, what will be there? Yes.
CO2 also.
Yeah, CO2. But what will happen?
Airway injuries.
Yeah, because this will be, thick smoke. Smoke. Because when there is a fire, the smoke which comes from this fire, it will be very thick, containing CO2. When someone inhale, it will cause CO poisoning, plus it will cause injury, inflammation and injury in the trachea, his tracheoles. So CO poisoning, Jama, airway injury can happen if the poisoning is due to house fire. So that means there is more and more risk of respiratory failure. Okay. Risk for exposure to CO. Who are the people at a high risk? So you can say in general, if you speak, everyone is at a risk of CO poisoning. Everyone. No one can say, I can breathe the CO, how much you give me, and inshallah I will be, no symptom, no poisoning, I will be active. No, all are at a risk. But mainly we will see high risk patients or people. Babies and infants, yes, they are at a high risk. Babies and infants, the elderly. So you can say the extreme age, a very small age and very big age, they are at a high risk. And people who are already having chronic heart disease, MI, CHF, okay, coronary heart disease, if they have heart disease, they are at a high risk. People who are anemic, they are at a high risk. And if someone is having breathing problem, okay, like having asthma, COPD or some, and the pregnant women. So in general, all are at a risk. In specific, these categories are high risk. Diagnosis of CO poisoning. Diagnosis is based on suggestive history, and you will take a history. Okay, we bought him from the factory, there was a fire, or he was in the home, or he was in the someplace, suddenly catch the fire, and he inhaled the smoke. Like this, you can take a history. Physical findings. Physical finding means you will see him, like his dizziness, he's confused, he's not answering you, he says he's having headache, he's vomiting, nausea, these signs and symptoms which are same like flu, but they are due to CO poisoning. So physical finding plus the history along with confirmatory test. You will do the ABG test and other test to check the level of gases in the blood. Diagnosis is considered when a patient at a risk have non-specific symptoms or metabolic acidosis. Yeah. Any the patient who are at a risk, this elderly, babies, breathing problem, this. And they are saying that they have non-specific symptoms, means they are having dizziness and breathing problem, chest pain. But when you ask them, they say, no, I'm not a heart patient, means the symptoms are non-specific. Or if they have metabolic acidosis, then you should consider diagnosing them for CO poisoning. And also we can diagnose with the help of venous carboxyhemoglobin level. And we will check the level of COHB, checking the level of carboxyhemoglobin. Because symptoms can be vague, means non-clear, non-specific and variable, the diagnosis is easily missed. Yeah, this is a problem because the symptoms are non-specific and the vague. So most of the time the diagnosis is missed. Many cases of mild poisoning with non-specific symptoms are mistaken for viral syndrome, means like a flu. Most of the doctor, they think it's a viral flu. Physician must maintain high level of suspicion. Here, who should be smart? The smart should be the physician who is diagnosing. They should have a suspicion that, yes, if people from the same dwelling means here the play house, if the people from same dwelling, particularly a heated dwelling, means they are staying in the place where there is no electricity, they use petrol, benzene, diesel and generators, so on, and the charcoal. If such people experience a non-specific symptom, then a physician should suspect that they may have CO exposure. Is this point clear? Okay. We are continuing the diagnosis. If CO poisoning is suspected, suppose, okay, you are having a doubt, oh, this case may be CO poisoning. What is the next step? Now confirm it. You have to suspect. Once your suspicion is yani high suspicion, then you will do a confirmatory test. How it can be done? You will check the carboxyhemoglobin level. Okay, you can check the carboxyhemoglobin level. How? Using CO oximeter. CO oximeter is a machine to check the level of COHB. Venous samples can be used because arteriovenous differences are trivial. Yani you can use the venous blood. No need that you should take blood from the artery, because you know taking which blood is easy. Can you tell me, arterial or venous?
And
Which
Venus,
one?
Doctor.
Yeah, venous
Veins.
is very easy. So the difference between the venous sample for COHB, you know, what you are checking? You are checking carboxyhemoglobin, means COHB. So whether you take a venous sample or whether you take an artery sample, no problem. The difference is trivial, means there is a very small difference. Mafi mushkila. Take whichever blood is easy for you. Okay, using a machine, CO oximeter. It is important to know how much time has elapsed since the patient has left toxic environment. Yeah, this is important. The time of exposure. Suppose he was, inhaled CO gas, maybe afternoon 2 o'clock, and he is coming to the hospital now. So you should know, means he was breathing fresh air for 3 hours. So, yani the level of COHB will change, because that will impact the COHB level. If the patient has been breathing normal room air for several hours, COHB testing may be less useful. Yeah. Suppose if he was on the way breathing fresh air for 4 hours or more, what will be the result? Yani your COHB level will be high or less? If the person was breathing 3 to 4 hours of fresh room air.
less.
Yeah, less, because as the person inhale fresh air, the carbon monoxide level will go down in the body. It will be exhaled. Okay. The ABG, arterial blood gases, are not measured routinely, and moreover, the ABG and the pulse oximetry alone or combined are inadequate for diagnosis of CO poisoning, because oxygen saturation reported in the ABG represent the dissolved oxygen and thus unaffected by carboxyhemoglobin concentration. Okay, so remember ABG and pulse oximetry. You know pulse oximetry, which they check in the hospital. You know, on the finger. You know, on the finger they put like a clip, check 97%, 98, 99.
Yeah,
Oxy-
doctor, usually and the thumb.
yeah, on the thumb. Yeah, on the thumb,
Yes.
in the legs or any finger. Yeah. So this is called as pulse oximetry. Means it will tell you how much is the oxygen in your blood. Okay. So normally it will show 95, 96 like this. So what they are saying, the pulse oximetry and the ABG, arterial blood gases, it is actually not so accurate. Why? Because when you do the ABG and pulse oximetry, you will get oxygen saturation which is dissolved, and this is not affected by carbon monoxide poisoning. So maybe you are getting a false result. Furthermore, the pulse oximeter cannot differentiate normal hemoglobin from carboxyhemoglobin. This is another problem. When you check a pulse oximetry on the thumb, it may still show you good oxygen, but actually the oxygen in the body of the patient is less and CO is high. Thus provides false elevated oxyhemoglobin level. Although elevated carboxyhemoglobin levels are clear evidence of poisoning, level may be falsely low because they decrease rapidly after CO exposure ends, and particularly in patients treated with supplement oxygen, mainly in the ambulance. Okay. Yani what I can say is you cannot completely depend on the ABG and pulse oximeter and COHB, carboxyhemoglobin level, because they will vary. If someone is breathing in the air, if he comes in the ambulance and there was oxygen given to him, so these levels can vary dramatically. Okay. So means what does it mean then? Are you not going to do these tests if someone have CO poisoning? Like, okay, I will not do pulse oximetry. No, you cannot say that. You have to do pulse oximetry. You will do ABG. You will do carboxyhemoglobin level using CO oximeter. You will do them. But along with that, you have to do some additional test. You should not completely depend only on these gas tests. Did you get the point clearly?
Yes, you have to combine them, right?
Yeah, yani these three tests. What are three tests? I will repeat. Checking the carboxyhemoglobin level using CO oximeter. Second, ABG, arterial blood gases. Third, pulse oximetry. These three you have to do, but should not completely depend on them. Plus, you have to do the metabolic acidosis. If there is a metabolic acidosis, that will be again a clear clue for the diagnosis. And you can also perform other tests to find out the exact problem. Like you can also do the ECG for chest pain. You can do CT scan for neuropsychiatric symptoms. An elevated level of COHB of 2% for non-smoker and more than 9% for smoker strongly support diagnosis of CO poisoning. Yes, I think you remember I told you in the beginning, the COHB level will be different for the smoker and non-smoker. Okay. So if a person is non-smoker, how much value? 2% of COHB will indicate that, okay, he has CO poisoning. And for smoker, it should be more than 9%. The COHB level do not correlate well with the severity of illness or outcome or response to the therapy. So it is important to assess the clinical symptoms and history of exposure when determining the type and intensity of treatment. Okay, again they are stressing on the same point, means just don't be dependent on COHB level. It will not tell you about severity of illness. Okay, it will not tell you about the outcome or response of the therapy. Did you get my point?
Yes, doctor.
Yeah. So there is a note. Carbon monoxide can be produced endogenously inside our body as a byproduct of heme metabolism, the RBC breakdown and heme metabolism. So what can happen? The patients who have sickle cell anemia disease can have elevated level of COHB in their blood as a result of hemolytic anemia or as a result of hemolysis. So what you will do here, you should keep in the mind, okay? Yani if a person is coming, he has a CO poisoning, but he is a sickle cell anemia, means he is already having some carboxyhemoglobin level. So the reading for such patient will be different. Talking about the treatment for CO poisoning, yeah, oxygen, 100% oxygen, and the hyperbaric oxygen therapy, which is in the picture I shown you. The patient should be removed from source of carbon monoxide and stabilized as necessary. This is a first decontamination approach. And if he is inside the room or in the factory, if there is CO poisoning, first thing is you have to remove the victim from this place and make him breathe. And they are given with the 100% oxygen by cylinder, and you will give it by the mask. Which type of mask? Non-rebreather mask. Means this is a mask which is non-rebreather, means once the patient inhale oxygen, oxygen will go in his lungs. When he exhale, the exhale air will go out. It will not go in the oxygen cylinder. Okay, that is called as non-rebreather mask. So oxygen should be given using this mask and treat supportively. Hyperbaric oxygen therapy typically should be considered for a patient who have the following. When we use the hyperbaric oxygen therapy, in the following. Yeah, if a person is having life-threatening cardiopulmonary complication, okay, ongoing chest pain, you are giving him oxygen by the cylinder, by mask, but still he is feeling chest pain. Patient with altered consciousness, patient who become loss of conscious, means they lose their consciousness, no matter how brief, and it's for small time, large time, how many minutes, don't think that. If they lose the consciousness, they are the eligible candidate to be given hyperbaric oxygen therapy by using machine. And if the carboxyhemoglobin level is more than 25% in the blood, if the patient age is more than 36, okay, and if the patient is pregnant, so hyperbaric oxygen therapy should be considered. And this is a photo you can see here. This is a hyperbaric oxygen therapy. So yeah, here the patients are placed in this chamber. You can see the chamber where the victim is sleeping. The patient is placed in the chamber, and what is the difference here? The atmospheric pressure is 2 to 3 times higher. Okay, oxygen is 100%, like a cylinder, like a mask, but the atmospheric pressure, or you can say the partial pressure or vapor pressure of this oxygen is high. Okay, hyperbaric oxygen therapy may decrease the incidence of delayed neuropsychiatric symptoms. Yes, very important. If you give hyperbaric therapy, means you are giving him pressurized oxygen, so it will go in his body, it will reach his brain. So when it reaches the brain, the neuropsychiatric symptoms, the chances of brain damage will of course decrease. This is a faida, yani the advantage. However, this therapy may cause barotrauma. Okay, this is the complication. This is the you can say the complication of hyperbaric oxygen chamber or therapy. What do you mean by barotrauma? Barotrauma means it is a damage. Barotrauma means it is a damage caused by high pressure of air. Did you get the point?
Yes, but it's unclear, doctor. Like injury for the tissue itself or the cells
no.
or what?
No. Good question. Barotrauma means because the patient is sleeping in this machine, okay, and there is a high pressure of gas inside this, 2 to 3 times more than the atmosphere. So what will happen? A person is breathing, that is good, but because of this high pressure, this pressure will be not good for the ears, you know, ear inside for eardrum. So
Yeah.
maybe for few days after taking this therapy, the patient, he will not be able to hear, or his hearing capacity is impaired, okay. And because of this high pressure, maybe he will have seeing problem because of high pressure on the eyes for few weeks, 2 days, okay, after the therapy. That is called as barotrauma. Is that clear?
Clear, Doctor. Yes.
And because the therapy is not available at most hospitals, it may require a transfer of patient who may not be stable. Also, the chamber may not be available locally. Means the another drawback of this hyperbaric oxygen therapy. Every hospital does not have hyperbaric oxygen chamber. It's very costly, very sophisticated machine, and require a lot of care. I think here in Saudi Arabia, the big hospitals only have this, like a ministry hospital and another big private hospitals. Every hospital cannot afford. Okay, means it's a drawback. Like, so if someone have CO poisoning in the village, in some village, so what you will do? There is no hospital with the hyperbaric therapy. Means it's not available easily. And the evidence for the efficacy of hyperbaric oxygen therapy is somewhat inconclusive. Means you cannot say, okay, I gave him hyperbaric oxygen therapy in the chamber, the result, the prognosis, the outcome will be mia fil mia. No, inconclusive. Maybe the outcome will be very good, or still the patient may have neuropsychiatric symptom even after hyperbaric. Is the point clear?
Clear, Doctor.
Okay. The other considerations include, if the patient is having a severe CO poisoning, you must perform ECG to check the heart function. Okay. And the patient who is unconscious, or the patient with cardiopulmonary sign and symptoms, chest pain and breathing dyspnea, breathing problem, in such patient, we must take chest radiography to see the chest, and also the brain MRI or CT scan of the brain. Why? Because we want to see, is there any cerebral infarction secondary to hypoxia or ischemia? Means, is there any brain damage, brain death due to this CO poisoning? This additional test, ECG, chest radiography, MRI of the brain, etc. All the discharged patients should be warned of possible delayed neurological complications. Okay, yani you should warn the patient who you are discharging from hospital. Suppose there was a patient, he came with the carbon monoxide poisoning, and you admit him in the hospital, and after 2 3 days you say him, okay, your blood oxygen is good, oxyhemoglobin is good, your saturation is good, you can go home. But you should say him that maybe after 2 weeks, 3 weeks, maybe you may have neurological complication. Means you will feel dizzy, you will feel like your memory is weak, becoming weak, you feel like you are not able to concentrate. If that happens, please follow up. You got the point?
Yeah.
Follow-up should include repeated medical and neurological exam in 2 weeks. Okay, next is the prevention. Sorry for interruption, let's continue talking about the prevention of CO poisoning, which is very possible. Prevention involves checking the source of indoor combustion to make sure they are correctly installed and vented to the outdoor. Yeah, if you have if you are using charcoal in your home or any other hydrocarbons, you should make sure that they are in a good ventilation place and all the exhaust smoke is going out. Good. And the exhaust pipes should be inspected periodically for leaks. The exhaust pipes which are going out of the house, they should be inspected for any leakage and servicing. CO detectors should be installed because they can provide you early warning that CO is free in the atmosphere. So you can run away from the home, or you can open the windows and the doors for CO to go out. If CO is suspected, and if the alarm, if there is an alarm by CO detector, then what you can do, open the windows, open the doors, and go out of the house. And the other preventive measures include have your heating system, water heater, and any other gas, oil, coal burning appliances serviced by the qualified technician every year. You can see in the picture. And if you are using any such utensil or appliances, you must make sure that you service them periodically. Yeah, never use a generator inside your home. Okay, generator, I don't know what you call in Arabic, the generator, if the which is diesel or benzene used for if there is power outrage, what you call the generator?
Yeah, for
Fan.
electricity.
Yeah, for
مولد كهرباء.
Yeah, this one. So never generator should be used inside the home or in the basement of the home, or not in the garage, or not less than 20 feet from any window, door, or vent. Means the fast line, the space between the house and the generator, ideally it should be at least 20 feet if possible. And never patch a vent pipe with a tape, gum, or something else. Okay, so if you have exhaust pipe through which the exhaust air goes out, don't try to repair by yourself. Okay, and this is an article from American Journal of Emergency Medicine. Some of the points are mentioned from this article, and the title was Economic Complications of Unintentional Carbon Monoxide Poisoning in US and the Cost and Benefit of CO Detector. Yeah, because I think I'm not sure, the CO poisonings are not so common here in Saudi Arabia, but they are very common in the US, and they have made a comparison like how many CO poisonings are there every year and how many people have installed CO detectors. So they have made a cost benefit comparison. Okay, Alas. Yeah, we complete our today's lecture. Any questions?